Here that pests are going to start emerging again, and more people are going to be going outside too, and that does include ticks.
Yeah, May is Lyme Disease Awareness Month. It's more important now than ever during this COVID-19 outbreak to prevent Lyme disease and know the symptoms on how to get help. So joining us now with some advice is Dr. Jonathan Otten from Northern Lights Medicine. Dr. Otten, thanks so much for joining us today. We talked about Lyme disease being even more dangerous now during the pandemic. Why would that be?
That people they seek medical advice, prompt medical treatment if they believe that they have contracted Lyme disease. So in some ways, there's no difference this year. It's really important that we practice prevention. As the weather warms and we're all anxious to get outdoors, it's really important to perhaps consider some social distancing with these little critters. There are some things we can do to dramatically reduce our risk of contracting tick-borne infections. So when we're out in the outdoors, things we can do like wearing long pants and long sleeves if that's possible. I like to recommend to my patients that they consider purchasing some Permethrin at a home improvement store or on Amazon, and treating their clothing, not their skin, with Permethrin. That dramatically reduces the risk of a tick infection.
What is Permethrin?
Also showering when you come indoors.
Yeah.
And be careful tick checks.
Doctor, what is Permethrin? What is that?
Permethrin is a chemical, it's similar to what the chrysanthemum family of flowers makes, but it's a chemical that will kill ticks with contact. So great stuff and fairly good safety, and if used appropriately.
Doctor, we know that Lyme disease can be tricky to diagnose. Can you share with us some of the symptoms if someone is feeling something that could be it?
Yes, so acute Lyme disease, we often see an erythema migrans or a bullseye target rash, but not always. People will develop flu-like symptoms, fatigue, malaise, joint pain, muscle pain, headache, fever, stiff neck. All of those can be symptoms of acute Lyme disease.
Obviously, people are trying to stay out of the clinic and stay out of the hospitals right now. If you have concern, how do you go about getting help?
Yeah, people should still, if they believe they have contracted Lyme disease, they should still be seen by primary care, urgent care, and seek prompt treatment. Prompt treatment is really, really critical with this disease.
All right. Very good. Dr. Jonathan Otten from Northern Lights Medicine. Doctor, thanks for being with us. We appreciate it.
Yes, and please, another resource is the Twin Cities Lyme Foundation for patients who believe they've contracted Lyme disease. Please check out this philanthropic foundation started by Lisa Najarian. Right. www.twincitieslyme.org.
We've had Lisa on the show before. She's terrific. It's a great nonprofit, and we've linked it at wcco.com/links for people too. Thanks, Doctor.